Hi, I'm Nancy O'Neill, and this week on Aging Gracefully, we discuss the importance of caregivers, plus we check in with the Suncoast Spa using LED light technology, and we talk heart health with Sarasota Memorial Hospital. Caregivers do so much for their loved ones that they often neglect their own needs. And here to tell us about caring for the caregiver is Inspired Living Regional Sales Director, Patricia McGraw. Hello, Patricia. So, Inspired Living, tell us a little bit about that before we get into the caregivers aspect of our segment today.
Certainly. Thank you for having me.
Of course.
Inspired Living offers senior living options for families. We offer independent living, assisted living, and memory care. My particular region that I support is from Tampa down to Bonita, which includes St. Petersburg, Sun City, Bradenton, Lakewood Ranch, Sarasota.
Busy kind of day for you.
I love it.
Oh my gosh. Caregivers. Obviously, we know that it's very prevalent to have a family member be a caregiver. How prevalent is it? And it's typically a loved one of some nature.
So it's more prevalent than we actually realize because over 44 million people in the United States provide some type of caregiving for an aging loved one. And when you're in that role, sometimes you don't realize you're in the caregiving role.
It's kind of a natural thing that you fall into a lot, you know?
It is, because you want to take care of your family member, you
Sure.
love them, and you provide the best love and care that anybody can.
Absolutely.
So it's a really important role.
Absolutely. Now, from your personal experience too, who is the average caregiver?
So the average caregiver is usually a daughter. But sometimes it's a son, but the majority of the time it is a daughter in her late 40s, around 49 years old. She has a husband and children of her own, and she has aging parents that she's also trying to help. So a lot of juggling going on.
And you said yourself, I mean, you've experienced it, I did as well. I think we all come into that role at some point.
It's natural.
It is. Now, there's a lot of different things that caregivers do. What does a normal caregiver's day look like to you?
So typically, if you have a family member helping a loved one, they're spending about 20 hours a week outside of their normal routine. So outside of their work hours, outside of helping their children with homework, outside of extracurricular activities. They may be providing medication management for their parents. It might be a spouse providing help to a spouse, but that the day takes on a different purpose. So caregiver might be fixing meals, taking over driving, laundry, driving to doctor's appointments.
Okay, well, I have a few questions here that I would like to ask our viewers so they know if they're actually in jeopardy of being not mindful of themselves. Is that fair to say?
It is. Sometimes you're caught up in caregiving and you don't take time to think about your own health.
Okay. So the first question is, have you had a physical or been to a doctor in the last 12 months? The second, have you done something socially in the last 30 days? And the final question is, do you spend at least 30 minutes 3 times a week exercising? Now, what should those answers be?
They should be yes, because caregivers put themselves on the back burner, and I did it, and I know you did it. And the outcome of that can be tragic. 30% of caregivers actually pass away before the person that they're caring for.
My goodness.
It's a staggering statistic. It happened with my mom and dad. If a caregiver's unintentionally can be causing damage to their own health by not paying attention to those social cues, taking time to be social, attending their doctor's appointments, taking care of themselves so they can help their loved one. And
Very
then
important.
exercising and good nutrition. Caregivers tend to have poorer nutrition. They tend to not exercise as much, and they tend to skip doctor's appointments for themselves because they're busy transporting their loved one and their children and everybody else to their appointments.
Now, is there help out there that you would give to families for advice?
There is, and the number one thing I would say is accept help. So oftentimes a family member, a relative, a neighbor might come over and say, do you need help? Can I offer assistance? It's okay to take it. I know we're all very prideful,
Yes.
and sometimes we say, no, we don't need help. But it's important to let the help in to your life for your own good, because other people may recognize the stress you're experiencing, and when you're caught up in the caregiving, you don't
see
realize it. It's
Yeah.
part of your life, and you love it, and it is a labor of love.
Yeah. Okay.
The other thing we offer is respite care. So we offer short stays at our assisted living communities to give family members a break. They could be 1 or 2 weeks long. Just
Oh, that's delightful.
some time to take care of yourself, attend your appointments, take a little break. There's nothing wrong with that.
Okay. And advice you would offer to someone caring for a loved one?
Take care of yourself so you can take
First.
care of your loved one.
Okay. Great advice. Thank you, Patricia.
Thank you.
Coming up after the break, we learn how red light therapy can help you burn fat. Body Balance Sarasota is changing the way you lose weight with their state-of-the-art LED light technology. And here with more on this local spot is owner Betty Troyer. Well, it's nice to meet the owner. We had Mo on with us during our last interview, and now we see the owner, and you're going to give us a kind of an overview of what Body Balance is, and then we're going to go into some topics about fat and weight loss, right?
Yes, I am so excited to be here. I cannot wait to tell you everything about Body Balance. There's so much to tell you that I can only touch in on a couple subjects today. But what we are is we're a non-invasive, no downtime, no recovery time fat loss spa. We're not weight loss, because there is a difference. And a lot of people don't realize that, but there is a difference. We utilize red light technology to literally melt body fat. And that is so exciting.
Yes.
It will put your body fat in instant fat burning mode. And it's so exciting to do that for people. And it's head to toe. So when you actually go into a bed, and it's not a tanning bed, so the light shines on you, but it doesn't tan your skin. And it's head to toe or targeted. You can actually target it. Like if you just want to lose the midsection, you just let the light shine on there. You can do that.
So do you direct the lights when you're actually in there in the bed?
Absolutely, the customer does.
Yes.
We don't do that. Because you're in a room by yourself. Nobody's working on your body. You're totally by yourself. You're in a spa-like setting, and we have soft music playing in the background, and you just lay there for 20 minutes and relax. You decide where you want to shine the light and what you want to do. It's head to toe or target, whatever you want to do.
I love it. I love it. Now, you said there's a difference between fat loss and weight loss.
Absolutely, there is a difference.
What's the difference?
So the difference is when you lose weight, you go on a diet, you lose weight. You get off the diet, what happens? You gain it back. And then you go on a diet, you lose weight. What happens? You gain it back. So you're on this up and down, up and down. And it's really not healthy for the body to do that. But when you do fat loss and you do red light therapy, you actually lose the fat, you lose the inches and not the weight. So therefore you get long-term results.
Okay, you're shrinking.
And you
the fat,
actually
right?
shrink. You shrink your fat cells, you shrink your body, and you lose inches, and you get fat in a fat burning mode. Yeah.
Now, when you talk about stubborn fat and what you do to do this. Do you diet in conjunction with it, or is it two separate things?
Well, that's why we say that dieting doesn't work, because of the yo-yo. You're up and down, you're up and down.
Right.
So that's why we try to tell people, be more consistent and go for fat burning and not weight loss.
Okay.
You get more long-term results.
All right.
And when you do the exercise,
Yes.
what happens is, I ask people this all the time. Do you go to the gym? And I get the same answers. I go for 30 minutes, 45 minutes.
Right.
When you exercise for 30 minutes before your body hits fat burning mode.
To begin
only for it to work. Only then,
Yeah.
anytime after 30 minutes, then you're going into actual fat burning mode. People don't know that. So they're spending huge amounts of time at the gym, but they're not in fat burning mode.
Right.
So
they're
when you
not really
come
benefiting.
Exactly. So when you come and you do the red light, then you are in fat burning mode. And you're not working out for 30 minutes before you get there.
Okay, so that in fact actually helps when we say diet. You don't really have to diet, you just have to get your body prepared to do the exercise, and that's what Body Balance does.
There's a science behind it, and we understand it. And we
Okay.
teach that to you.
Okay.
And that's where you can target stubborn fat. People say, I go to the gym, I have great abs, but I still have this little pouch here.
Right.
What can I do about it? And yes, we absolutely can take care of that.
Okay. Now, obviously, you're very passionate about this.
Very much.
And I know we've talked, and you've done months of studying and
Yes.
research on this. Tell us why you're so confident in this technology.
I am not only confident, but I absolutely know it works, because I have seen results. I have seen what it does, and I know that it works. It is unbelievable what it can do. It can do body contouring, stubborn fat. You can actually get rid of stubborn fat. You have stubborn fat on the legs,
Yep.
but you're fine everywhere else.
Yep.
We can take care of that. You have stubborn fat in more areas. We can take care of that. So we can do all of that.
And do you have a success guarantee on this?
We absolutely do.
Do you really?
Yes, we do. There's actually a couple guarantees I can give you today.
Okay. All right.
We will guarantee inch loss. We know it works. We will guarantee that if you call us, we will have a team of people there. We understand your frustration. We know what you're going through. We absolutely know. So we guarantee that we are there for you. You're going to get great customer service.
Okay. Now, when you first come in, and I know we had Mo chatting about this, but tell us again about when you come in, a client comes in for a consultation.
You get a
Full body.
So the first 50 callers after this, they're going to get a free.
Oh, okay.
They're going to get a free body analysis, and it's going to tell you your metabolic age, and there's just so many things it's going to tell you about the body.
Okay.
And then you get a free educational consultation, because there are tools that we use with red light, and we show you how to best use the tools to use the red light for the very best results for your type of body, for what the analysis shows.
And we're going to be talking specifically about those particular topics in the weeks to come.
Absolutely. I have more topics to come. It's going to be very, very exciting.
Okay.
Yes.
Wonderful. I just love it, and I think it's cutting edge, and I need to get in there, so we'll see you
It
soon.
absolutely is.
Okay.
Yes.
Thank you, Betty.
Thank you.
Next on Aging Gracefully, tips for heart health with Sarasota Memorial Hospital. Heart health is so important, but many of us have no idea if we could be at risk. Here to tell us about aortic valve stenosis is Dr. Jeffrey Sell, Chief of Cardiothoracic Surgery at Sarasota Memorial Hospital. Doctor, it's a pleasure to meet you, and I am really honored to have you here, truly. I watched some tapes on you, and I know you have degrees from Harvard and MIT and Yale. So we're so pleased that you're here with us in Sarasota.
Oh, thank you.
So thank you.
Thrilled to be in Sarasota.
Oh, great place, great place. Now, please tell our viewers about this procedure, the aortic stenosis, and what causes it. First of all, what causes it, and then we'll go into the procedure.
So there are few causes of
Okay.
aortic stenosis, and apropos the name of the show, sometimes the aortic valve does not age gracefully, and it develops calcification, which is a hardening of that valve. It's designed to open and close. It's a very thin valve normally, and once it becomes stiff, it's very hard for the heart to pump the blood through
Okay,
that valve.
Where is that actually located?
That valve is right in your heart, right at the beginning of the aorta, which is the largest artery in the body.
Okay. Now, do you find that there are certain people that are more at risk for this?
So a lot of people as they age will get this just with the process of aging. Some people who have had rheumatic fever will get this at a younger age. And then there's some people who are born with a valve that's abnormally formed, and they tend to be the youngest people to get affected by it.
Okay. Now, how do you diagnose this? How would somebody know at what point they should come in and see? What are the symptoms?
Well, the first sign is a heart murmur, but a lot of people can have the heart murmur and it not be a problem. But then usually if a cardiologist sees a person with a heart murmur, they'll do an echocardiogram, and that can tell you exactly how well that valve is functioning. The symptoms of aortic stenosis, there are really three main symptoms. The first one is what we call syncope, passing out. You get lightheaded and fall over. The second is chest pain, which is like the chest pain you get if you have coronary artery disease, but it's still a symptom of the valve. And then third is shortness of breath. And it's important to know that aortic stenosis is a very dangerous disease, and that the survival rate of untreated symptomatic aortic valve obstruction is worse than most forms of cancer.
Oh my. Now, when you mentioned the three signs, would those necessarily happen all together or in a short period of time, or could you have one and not the other two?
Most people usually
or?
only get one. Some people will get two.
Okay.
What we know is that if you pass out, you have about 2 or 3 years to take care of the valve before is about how long you'll survive.
Okay.
If you get the chest pain, maybe 1 or 2 years, and with shortness of breath, most people don't make it more than a year without having something done to the valve.
Okay. Now you have a new procedure. It's called TAVR. Could you tell our guests what that is? And it's a non-surgical option for
Correct.
people.
There's a procedure we do now for the aortic valve to replace it. In the traditional therapy for aortic stenosis is an open heart operation. We can go a number of ways to do that. We can open the entire breastbone, or we can make a small incision, usually on the right side of the chest, and go through there. But now we also have a way to replace that valve using a catheter. And we do that in conjunction with our cardiology staff, one surgeon, one cardiologist in each procedure. And we use a catheter that goes through any number of access points, most commonly the artery in the groin called the femoral artery, sometimes the artery to the arm, which is called the subclavian artery or the axillary artery. And this week we just for the first time used the carotid artery as a way to get the valve to its position.
Okay. Now this is this is a new procedure.
It's
that
been
you've
going on
developed?
for about 6 or 7 years.
Okay. But you have a hybrid lab. Is there something that's
Yes,
special about
we have
that?
a very special room that's designed to be both a catheterization laboratory and an operating room. So anytime we have to do anything that involves manipulating catheters as well as surgery, we can do that. So we use that for special kinds of pacemaker procedures that we do the TAVR or a catheter-based valve. And even interestingly enough, I think we've delivered 6 or 7 babies there in women who've had problems with potential bleeding from the uterus after the delivery.
Now, obviously, you're the primary operating doctor in the
We actually
operating
have
room?
2 doctors, and we each have different roles, a
When you're-
cardiologist and a cardiac surgeon
Okay.
for the catheter-based valves.
All right. And what is the outcome on your patients? What are you hoping for when you
So most
operate?
of the time, these patients undergo this procedure, and nowadays most of our procedures are done under heavy sedation, not general anesthesia. They spend the night in the hospital, sometimes 2 nights, depending on where the access is to put the valve in, and then go home.
Really?
Yes.
And once they get home, what is their downtime at that point?
Their recovery is very quick. They're essentially back to normal at that point, already feeling better because they're not having the breathing trouble from the valve.
Okay. Now, you just celebrated a very special anniversary of sorts.
Yes, we within the last few weeks we did our 1,000th catheter-based valve TAVR procedure.
Yeah. And what does the TAVR stand for?
Transcatheter aortic valve replacement.
Okay. All right. So, how many of those 1,000 were you involved with, Doctor?
About 300, a little more than 300 of them.
That's amazing. That's amazing. Now, how many are on your team when you say there's you and the other primary doctor in the room?
So we have 4 cardiologists that do the procedure. We have 5 heart surgeons that are involved, and we all work together, selecting the patients, performing the procedures, and making sure that their hospital course is good.
Okay. All right. Well, thank you, and we can reach out to you at Sarasota Memorial Hospital for any more questions we have, correct?
Yes, ma'am.
All right. Thank you again for being here.
Thank you very much.
Thank you for joining us on Aging Gracefully, and find more episodes throughout the season on snntv.com. Join us next time for more tips on living a happy and healthier life.